Pancreatic cancer remains one of the most challenging diagnoses in oncology. But in 2026, we are seeing meaningful progress that is changing the outlook for many patients. Welcome to the latest 2026 update on pancreatic carcinoma. We'll explore the current statistics, standard care, and the breakthroughs redefining treatment today. The burden of this disease is significant. Each year in the United States, there are approximately 67,500 new cases diagnosed, and sadly, over 52,700 deaths. However, there is hope in the numbers. The overall 5-year survival rate is now around 13%, nearly doubling from just 7% only a decade ago, reflecting better care. Early-stage disease continues to show much better outcomes, with survival reaching up to 44% for localized cases where surgical intervention is most effective. The challenge remains that most patients are still diagnosed at advanced stages, making the development of new, more effective therapies a critical priority. Currently, standard treatments include surgery when the tumor is resectable, often followed by or preceded by intensive systemic therapy. Traditional chemotherapy regimens like FOLFIRINOX and gemcitabine plus nab-paclitaxel remain the backbone of treatment for many patients across the country. We have also seen the introduction of newer regimens like NALIRIFOX, providing more options for patients to manage their disease effectively. But the most exciting shift in 2026 is the rapid transition toward targeted therapies, which aim to attack specific genetic drivers within the cancer cells. A major breakthrough is daraxonrasib, also known as RMC-6236. This is a first-in-class oral RAS-ON inhibitor that targets multiple KRAS mutations. In a pivotal Phase 3 trial for previously treated metastatic disease, daraxonrasib demonstrated clinical results that have truly stunned the oncology community. The drug nearly doubled median overall survival to 13.2 months, compared to approximately 6.7 months for those on standard chemotherapy alone. It also showed a marked improvement in progression-free survival, allowing patients more time before their disease begins to advance again. Importantly, daraxonrasib had better tolerability than traditional chemo, preserving quality of life for patients during their treatment journey. Other advances include tumor-treating fields, or Optune packs, which recently gained approval for use alongside chemotherapy to help disrupt cancer cell division. We are also seeing ongoing progress in KRAS G12D specific inhibitors and new immunotherapy combinations that are currently in late-stage clinical trials. Surgical techniques are also becoming more precise, and multidisciplinary care at high-volume centers is significantly improving patient outcomes across the board. The future looks more hopeful than ever, as precision medicine allows us to tailor treatments to the unique genetic profile of every patient's tumor. This is a rapidly evolving field. We strongly encourage you to consult a pancreatic cancer specialist and consider participating in clinical trials. For support, resources, and more information, please visit the Pancreatic Cancer Action Network. Progress is possible.